So we'll go through and have a look at all of the detail that we need to see. There's quite a few things that we want to look at today, so I'll talk you through them one at a time as we go along. So this is the placenta here forming along the back wall of the uterus. And this is the birth canal here, which is nice and long and closed. That's the opening to the uterus. The fluid around the baby in the amniotic sac looks normal too. This is your left ovary. And it looks like that's where the egg for the pregnancy came from. That's where you ovulated from. Just have a look for your other ovary as well.
Oh my god, it's amazing.
And this is your little right ovary here, and that looks normal too. So now we can have a look at the little one here, and we can take a measurement from the top of the head down to the bottom. It's one of the measurements that we do to look at baby's growth as well. And that measurement fits in very well with your due date.
Awesome. What's the due date? Can you see that there?
Well, you've got the doctor's written a due date of the 18th of July, is that correct?
Yeah.
So the baby's measuring just a couple of days either side of that, so that's well within the normal range.
Okay.
So the growth of the baby is fine. Just having a look down on top of baby's head, we can see the nice midline of the brain and the two halves of the brain symmetrically on each side, and the shape of the skull around the outside looks good too. It's moving a lot as well. So we can also see that baby has a little nasal bone here too, which is very reassuring. Often babies with Down syndrome will have a missing nasal bone, so the fact that that's present is a reassuring sign. And then we also take a measurement of the layer of fluid at the back of the neck. And the theory behind the Down syndrome screening is the thicker the layer of fluid, the higher the risk of Down syndrome. So I'm just trying to take that now. It looks nice and thin, it's just this little layer of fluid here, but I need to get a better measurement of it, so we'll just wait for baby to move. And see a little bit of the head and brain, the face development here too, the little eye sockets, the little nose and mouth area, little hands moving around, we can see the little fingers.
That's amazing.
A big wriggle now. Fingers opening out on the little hands. It's very active, it's just turned all the way around.
Wow. That's amazing.
See how it's gone face down now?
Wow.
Looking at us. So we've
It's
got
like what
two
this
arms
thing
and two
moving.
hands. Hand down here, and then the other little hand, see the little fingers
That's amazing.
belonging to that hand. Little heart beating here. Nice fast heart rate. About 155 beats per minute. So we don't get a great deal of detail of the heart at this stage. It's about the size of half a pea, so it's pretty tiny. What we do like to see is we can see that the heart is sitting inside the chest. It's beating nice and fast. It's on the same side of the body as the stomach. That's a little stomach there, full of fluid, which is good. It means baby's swallowing nicely. And when we have a look at the heart, we can just start to make out the little valves opening and closing on each side, and the different little chambers of the heart, and the blood flow in the little vessels coming back towards the spine as well.
So happy to see that.
That looks good too. moving down the body a little bit further, we can see fluid in baby's stomach, the cord coming into the front of the tummy, fluid in baby's bladder there a little bit as well, and the little legs and feet down here, one little foot belonging to that leg and the other little foot going underneath there belonging to that leg. So I'll just try and get baby moving around a bit more too. So we can certainly see that baby has 2 arms and 2 hands. We can see 2 legs and 2 feet, brain and skull development, symmetry of the face, those major organs within the chest and the tummy. You can see the spine coming down to the bottom and the little kidneys. So I'm just going to try and wriggle your tummy a bit. Legs are straightening out there now too. So what I'm going to do now is I'm going to get you to go to the toilet and empty out your bladder, and then we'll come and have another look. Hopefully that will make baby move a little bit. So far so good. I just need to get one more measure. Everything's looking good today.
Did you have the chance to see the size of the baby?
The size of the baby? Yeah, the size of the baby is just on 6.5 centimetres. So about that big.
Okay.
So I'll show you where the toilet is. Just need to see a few more things. We're looking good so far. So the toilet's around the corner there to the right, and I'll be back in a minute. So hop back up on the bed. Did you have any questions about anything so far?
No, so far so good.
No? It makes sense to you as I'm talking you through it?
Yes.
Yep.
Yeah, I'm pretty happy. Everything seems to be perfect.
Yeah, so it's a big scan to get through this one. There's lots of things that we do see, so not seeing anything of any concern is very reassuring. Just move a little bit towards me. Get a slightly better measurement of this layer of fluid here at the back of the neck. It looks fine, it's nice and thin. Just need to get a slightly more accurate one. Looks good.
Amazing.
So hopefully that result for Down syndrome will come back as a low risk for you. I'm not seeing any concerning features on the ultrasound, but the best test for Down syndrome is that blood test that you've had. So how long ago did you have the blood test?
Maybe 1.5 weeks ago.
Yeah, so you should just be able to ring up your doctor today and find out the results, unless are they on holidays? So you're seeing them on next Monday, are you?
Yeah, next week, next Thursday actually. But yeah, I might.
But you could just ring up, and find out, because the results should be back by now. So all looking good today.
Awesome.
So I'll send you some photos that I've taken as well to your phone. So I'll just check your mobile number in a moment, but we don't need to do an internal scan or anything because we're seeing the detail really quite nicely.
Okay, thank you very, very much.
Okay, no worries.
Really good to hear that.
So that's all on the US